Warm welcome to you from Geneva, Switzerland. This is Minja from the Geneva Learning Foundation. It's my pleasure today to welcome you to our second responsive feedback workshop. And the purpose is very simple. We have 3 live workshops, and this is our second one. Last Friday, we did the first one. And the goal is to help you use this new approach called responsive feedback to problem solve your implementation challenges. And second, you're welcome to present the work that you have been doing in the responsive feedback module and to learn and get feedback from peers as well as our subject matter experts. And so the time is 4 p.m. Geneva time. So the same time next Friday, we will have our third workshop. And here I would like to launch a quick poll. And I see that I see Rita, if you are able to launch the poll right now as the host, it says my polling session is inactive. If you could help launch the poll, that would be great. But the question basically is asking you, how are you doing with the responsive feedback module? And there are 4 options, and I would like to ask you, if you have started with the module, or you have completed the module, or you have not yet started and you do not know how to start. So please, if you do see the poll on your screen, please type your answer. You're also welcome to type it in the chat. I see that Daniel has shared in the chat that he has completed the module. And I see that probably the poll function is related to the link issue. So at this point, I would like to invite you to type in the chat, yes or no. If you have started the responsive feedback module, please type yes. And if you have not, please type no. I see many of you are saying yeses. I see lots of yeses. You have all started. I want to say bravo. And Dayo also said they already submitted worksheet number 2. Hawa Bohari already said you completed it. So it sounds like everyone in the room today have at least started the module. And so I just want to remind you all that the goal of this module is really to support you with the field implementation of your action plan that you're doing in the Impact Accelerator. And this is the week 2 of the Accelerator. And today Rachel is with us, and on Monday, in fact, you heard directly from Professor Viswana, who joined the Monday Assembly to share with you his comments and his remarks on why responsive feedback could be helpful to you to support your field implementation. Now, if you have already started the module, but you're not interested in getting certification because you're just interested in curious to learn how to use this new approach in your daily work, then you can take your time and go through the lessons in the module. However, I want to emphasize here, if you do want to gain certification for the module, there is a deadline to meet, and that is next Friday, June the 10th. You need to complete the module before then. And this is one of the requirements. So by completing the module, we mean that you need to submit the 2 worksheets, one on learning agenda, one on stakeholders by next Friday. Also, attendance in the live workshops on Friday is also a requirement. Of course, if you have a legitimate absence, you will be able to catch up by doing a catch-up task. And I would like to share that 261 scholars in the movement for IA 2030 are making progress with the module, and 46 among you have already completed both worksheets. You can see here the list of names, and I want to congratulate these 46 scholars. If you do see your name here, bravo. And when the time comes, we would like to invite you, if you would like to present your worksheet, your learning agenda, this is the opportunity to get feedback from your peers and Rachel. If you do not see your name in the list, however, there's still time, a week for you to do so. And without further ado, this session is really about hearing from you. And so I would like to pause here and invite you, if you have an implementation challenge with your action plan, please you raise your hand and we'll invite you to share what exactly this challenge is, so that your peers in the room can help you problem solve it together using responsive feedback. Or you could also present your learning agenda, which is worksheet number 2 in the module. So I see that there are already 2 hands raised. So I'm going to go first to Joshua. Joshua Yeneomi. Joshua, I hope you're able to unmute yourself. How are you doing, Joshua?
Hello.
Hello, Joshua.
I'm fine, are you?
Good.
Yeah, can you hear me?
Yes, loud and clear. We can hear you clearly, Joshua. Would you like to share? Would you like to share an implementation challenge, or would you like to present your learning agenda?
I would like to share my challenge.
Okay, we do have a set of questions on the screen. I'm going to copy and paste this set of questions into the chat, so you can also see it directly from your in the chat. So Joshua, can you first of all introduce yourself, who you are, where you connect from, and then answer each of the questions you see on the screen to tell us, to explain what exactly it is that is your challenge. Go ahead, Joshua.
All right, thank you very much. My name is Joshua Enemi. I'm connecting from Nasarawa State, Nigeria. Okay, I started with the team for IA 2030 movement. I developed, did my situation analysis and action plan. However, I have a challenge now. I was implementing from FCT Nigeria, Federal Capital Territory Nigeria. Presently, I've been redeployed to another state. So following up with the process is a challenge. That is my basic issue now. So I really don't know what to do. I may not be able to answer all the questions as presented on the screen.
Yes, please go ahead, Joshua. Explain to us what is the specific goal you will achieve by June the 17th? And then what action are you taking this week?
I have not started anything, is what I am trying to say, because I cannot follow through with my accelerator project. I have been redeployed, so going on ground, doing my work is a challenge now.
I see. So Joshua, if I understand correctly, your challenge is in fact, you're not able to start implementing your action plan. Is that correct?
Very true.
Okay, so can you share a little bit more what are the barriers that prevent you from starting implementing your action plan?
Like I mentioned earlier, the major barrier I have is that those challenges I identified during the movement were in a specific state. So implementing it is challenging now because I have been deployed to another state currently.
I see. And why is that a barrier?
Of course, that is a barrier because the state team I work with, we are supposed to conduct like a survey outside what we have identified during the situation analysis. Then we are supposed to be meeting together regularly to provide solutions. But because I'm not working in that state again, I cannot really sit with them to do all of this. That makes my implementation a challenge. That's a barrier there.
Okay, I see. Joshua, can you perhaps say a little bit more about your action plan? I do encourage the peers in the room, listen carefully to what Joshua is sharing. She has a very, in fact, urgent challenge because she's not able to start implementing her action plan. And so Joshua, for all of us in the room to be able to help you, we would like to better understand what exactly is your IA 2030 action plan about. Is it about, yeah, is it about coverage or is it about other aspects? Please explain a little bit more so we can understand.
Okay, my challenge is not about coverage. My challenge is actually geared towards AEFI reporting and documentation. AEFI is associated with COVID-19 vaccination, reporting and documentation. I observed that there are discrepancies and reporting across different platforms. So our planned action was to see how we conduct regular data harmonization meetings. Then I will support the local governments to ensure they sit at that level, local government or district to sit at that level to compare data from the surveillance units and the routine immunization units. Then how we plan to see that there is this synergy between the disease surveillance officers at the state level and the routine immunization team, so that whatever that goes out from the state at both ways is the same data. So I'm unable to really sit with them to ensure all of this is done. So I know as at last month there was one data harmonization meeting, but from the fallout, we are still having those issues.
Thank you, Joshua, for sharing that. I'm sure your peers in the room, I hope that you're all listening carefully, and I want to turn to you. We have, in fact, many hands raised. So if you have a comment to share with Joshua to help her with her challenge, please raise your hand. And I want to go to Sayed first. And Sayed, what you have heard the challenge that Joshua has, what comments or feedback do you have for her?
Thank you, Raja, and thank you, Joshua. This is a really, sorry to introduce myself. This is Dr. Amir Masha from Afghanistan, working with WHO, country office. The challenge is really true challenge, and it is everywhere. This challenge is available, and it is a problem in our country as well because of this AFI reporting system and recording system is not reported all over the world. I think because of the system is not developed in such a manner to work on it, and for that reason we have to train these healthcare providers. Even though the vaccinator are providing vaccines to the clients, but whenever they are facing such problem and if cases are coming to doctors and they are not going back to vaccinator, and there is no system with the healthcare providers to report these AFI cases. So we have to think about that, and we should train the healthcare providers, and they should report through the system. For that system, we should have AFI committees at national level and sub-national level, and they should work, and they should orient healthcare providers, and they should follow the system there. Hours from my side. Thank you.
Thank you, Syed, for sharing that. Joshua, I hope you're listening carefully, because we will come back to you for your reaction to peers and other scholars' comments to you. So I see lots of hands raised. The first few, I want to go next to Meles Tafari. Meles, your hand is raised. What comments, and first of all, can you introduce yourself? Although I know that you did so already in the social time before the session, but can you first introduce yourself to Joshua and all of us, and then share your feedback to her?
Okay, thank you, scholars. Thank you, Joshua, for your presentation. I'm Melissa from Ethiopia, researcher working in Armahasa Research Institute. I'm also co-investigator in effectiveness study of COVID vaccine that is currently used in Ethiopia. I'm sorry to just say to listen Shosha that she get emergency problems to tackle her implementation. So maybe my comment is focused on at the beginning during the situational analysis. Joshua maybe something that she lose. Did she properly analyze the situation that when she identify and develop just a methodology to address the identified gaps? Yeah, there may be actually problems, emergency problems, but when we analyze the situation, it's really good to identify the possible solutions to address possible gaps. So Joshua, maybe it's important to go back to your situational analysis and action plan and try to see again. Yeah, thank you.
Thank you, Meles. I have a follow-up question to you, Meles, in terms of your comments back to Joshua. So you are, if I understood correctly from what you shared before the session started in the social time, is that you're taking the responsive feedback module. My question to you is, what have you learned from the responsive feedback approach that you think could help Joshua to tackle the challenge she has right now?
Yeah, this responsive feedback is very important to address this type of problems that maybe affect my implementation activities. For example, during planning of our activity, during developing of our assumption, and when we just evaluate the assumption, and when we develop learnings, it's very important point to identify the expected problems that may be faced when we are going to implement our action plans. So maybe using this responsive feedback module properly is very important to address this type of problems that maybe affect our implementation, future implementation plans. Yeah, this is really important to address. Thank you.
Thanks, Meles, for sharing those comments. And I see Atahir Abubakar. Atahir, your hand is raised. Do you want to share a comment to Joshua? Or yes, was the hand raised? Okay, please go ahead, Atahir, introduce who you are and share your comments, and especially what you have learned from the responsive feedback module that you think could help Joshua in this case. And after you, we will turn to Dr. Rachel McLeod for her comments to Joshua. Go ahead, Atahir.
Okay, I'm Atahir Abubakar, technical advisor supporting Zamfara State Primary Healthcare Board Organization. My advice to Joshua, based on the responsive feedback, let's her go back to her learning questions. Let's her ask some of the people on why is documentation very poor especially for AEFI. So based on this learning question, she will hear from them. It will help her improve on her work. Let her get feedback from her colleagues first. Then she'll go back to her situation analysis and improve it.
Okay, thank you, Atahir, for that. I do see a final hand raised before we, so I want to go to Tina. I want to go to Tina first before turning to Rachel. So Tina, if you could unmute yourself, and would be great to hear from you what comments you have. Tina, are you able to activate your microphone? Okay, it looks like Tina may be trying to activate. In the meantime, Rachel, you have heard.
Afternoon.
Right. Okay, great to hear from you, Tina. Can you introduce yourself and then share your comments and suggestions to Joshua to help her tackle her challenge?
Yes, my name is Tina and I work with UNICEF Canon at the district level. I'm the C4D officer for polio routine immunization. I want to comment on the situation in which Joshua is at the moment. It's something that happens to that could happen to any one of us. And in a situation like this, I think with the responsive feedback approach, she should be able to have mapped out the stakeholders, which she wanted to work with in the project. Since she's leaving her district or her first area of assignment to another location, she would have identified somebody who is competent, trustworthy to be able to continue with the project based on the analysis she has put on ground, so that it will just look like a handing over thing to the person, to a stakeholder that will continue with the project, and then she can also monitor and see that things are going on well according to her plan. In responsive feedback, you are supposed to be successful in whatever project that you put on ground. So I want to advise her to continue with what she has put on ground based on the stakeholders she has line listed or documented. She should hand over to the person to take over from where she stopped, and then she will monitor the program from wherever she is. Thank you.
Thank you.
Yeah.
Thanks a lot, Tina. I can hear already from Joshua who is saying thank you to you, Tina, for your comments. I do want, for those of you who may have joined a little bit late, so we have Joshua from Nigeria who has an urgent challenge, and her challenge is she has been redeployed to another state in Nigeria, and so the time she does not have the time to visit her previous station, and that is the challenge that she's having, which prevents her from actually implement her action plan. So at this point, I want to turn to Rachel, who has been listening attentively. Rachel, what comments, how would you tackle, or what comments do you have from the perspective of responsive feedback?
Thank you, and hello everybody. It's nice to see you again, and nice again to hear all of your comments and feedback, just because you're the subject matter experts in the room, on the ground and doing this work. So I think it's really valuable to hear these points. And I think it's interesting hearing this challenge because it really highlights how responsive feedback and the agility that it provides can be useful. And I've heard other people mention, I think, some really key points that I was thinking about myself. First of all, I completely agree that making sure you're evaluating those stakeholders and those partners that you can have maybe on the ground, even if you aren't able to travel there as much, and those people that can give you that feedback and that understanding and help you, because it sounds like you're not able to implement that initial plan as you had it set if you're not able to visit the area and your proximity to the project and being able to be there on the ground has changed. And so I think that it's going to take some flexibility to think through and reorient how you're going to plan those activities. And so making sure that you have that stakeholder input and getting those range of voices that are there and able to observe and partner with you and give you that help is definitely a key first step. And then I also think that, you know, maybe this has changed your initial assumptions about how this program can even operate and how you're able to fit within this program as well. And so perhaps in your original plan, you were going to be there a lot more in person. You're going to be able to have these data harmonization meetings and really train people yourself, or, you know, however that was kind of set up. And, you know, I think that responsive feedback then can provide you a way to kind of maybe go back to your action plan, make sure you're sticking to those goals, but really seeing what assumptions have now changed. If you had assumed that your project or your course of action was going to work because you were going to be able to do certain steps, and now you're not able to do those steps, you can kind of see how those assumptions underlying your original plan as you wrote it out might have changed. And I agree that analyzing that situation, thinking again about the barriers that you're facing, and now those barriers have changed and become more complicated because you're also having to rely on others maybe and not be there on the ground as much, and just kind of rethinking how this shapes the assumptions, how this might change the activities that you're able to implement, and maybe then being able to go through that process. You started here. We know, especially in times of crisis or in these rapidly shifting situations, we often see that the plan has to change from what we started with to where we ended up. We've got several examples of this and how responsive feedback has been useful, and just kind of taking that step back and allowing yourself that flexibility, if possible, to go in and walk it through again. So if your original plan won't work, see where are those points, those pain points where it's not going to work. And it sounds like if you're not able to be there and do things in person that you thought, that's a definite pain point and maybe one of the issues you can press on. And as another participant said, maybe you have to rely more on stakeholders, or what are those things that you can go through? What is that environment in which you're operating? And maybe finding out more information about how you can kind of change gears and work within that environment. So I think that you've gotten a lot of interesting feedback so far. And I think that this is really going to rely on you being able to kind of think through and count on that flexibility and maybe shifting how those activities are going to look to reach that goal. So I wish you luck in this process. I know it's definitely a challenging situation.
Thanks a lot, Rachel, for those comments. I want to go back to Joshua. Joshua, if you're able to unmute yourself, to hear from you, what are your reactions after hearing your peers as well as Rachel's feedback?
All right, thank you very much. Thank you for giving me the floor. So I actually have to thank all those that have given me positive feedback. For me, I'm thinking of going alongside with Tina's suggestion. Like I mentioned earlier, the harmonization meetings are ongoing. I'm tracking them. However, I observed that during the last meeting, we still have this. We need to still dig deeper.
Thank you, Joshua. I think it sounds as if Joshua, you're having a little...
actually changed. So, but I'll need to identify the new ones on ground and see how we work together and come up.
Okay, thank you. Thank you, Joshua, for those reactions. I personally wasn't able to hear everything you said because your connectivity seems to be having some issues, but I encourage you to type in the chat what, as Rachel and your peers have suggested, what next actions you're planning to take now that you've heard all the feedback. So I want to pause here and to go back and invite everyone in the room do you have an implementation challenge that you need help with? If so, please raise your hand. We'd love to hear what challenge you're facing and how we as a group can help you. Second, you are also welcome to present your learning agenda, which is the worksheet number 2 in the module. So I'm seeing 2 hands raised. So let me go to Adamu Dagona first. Adamu.
Yes.
Adamu, would you
Hello.
like to share your implementation challenge, or would you like to present your learning agenda?
Yeah, the learning agenda.
Okay. We do
Sorry, the implementation plan. The implementation plan.
the implementation challenge, you mean?
The plan, I mean, and the challenge also.
Okay. So please, first of all, Adamu, introduce yourself, who you are, where you connect from, and then answer each of the questions that you see on the screen. So the floor is yours, Adamu. Please go ahead.
Okay, all right. So my name is Adamu Galadima Dagona from Nigeria, Yobe State. So, in fact, I'm a microbiologist working with federal investigation in Yobe State. So, in fact, it is a very interesting experience to have myself in this IA 2030 agenda. So my goal is to determine the vaccine hesitancy and also to determine the perception and the knowledge, beliefs, and attitude of individuals on the credibility and effectiveness of the vaccine, COVID-19 vaccine. Hello?
Yeah, we're hearing you loud and clear. Please continue. Answer each of the questions that you see on the screen. So you dealing with that vaccine hesitancy, that's your that's one of the things that you're focusing on, Adamu. But what is the goal that you plan to achieve by June the 17th? And what is the action you're taking this week?
Yeah. So right now, I just want to ensure I had the instruction with the partners and that of the major stakeholders. We had that interaction with them. And you know, I also want to conduct a survey. I just want to determine what are those, the hesitancy on why people doesn't want to take the vaccine. So what is the reason why people have some perception and that's of the beliefs towards not taking the vaccine? So like in the facility in the school, that is the federal investigation, we have the clinic, and the clinic is fed up with the central clinic in the local government in Geshua. So they provide the vaccine and everything, and the staff of the federal university, they're using the vaccine in order to administer to all those eligible. So, but my own challenge here in the implementation, I haven't done the interaction with the major stakeholders, the supervisors and the partners and the volunteers that we are working together in that school to ensure that we have enlightened people in order to know the importance of taking this vaccine. I have already done the validating the sample questionnaires that we are going to see, determine the responses. And also now my own challenge, you know, in the, maybe, you know, the Nigerian universities, we are on strike, the academics. The main challenges that I face is some of the staff in the clinic, they are all, many of them are on strike, but I'm able to mobilize some of the volunteers among the students. Then we have trained them, we have given them the input on how the project will be. So we have done that perfectly, but the main challenge, we cannot use the initial health facility of the university. We have to identify at least 3 facilities in there, then to collect those responses of an individual that we intend to take there. views and their own perception towards taking vaccine. So now my own challenge is we are now on it in order to retrain all those students to tell them what is the intrigues of how the interview will take place and all the responses that we can help the respondent in order to respond towards the successful implementation of the exercise before June 17th. But now my own challenge, we have done with the health coordinators, the major stakeholders and the funders there, we have agreed and we have understand each other. We know what resources we need in order to have a successful kind of research within the time frame. So now my own challenge is some of the students that we incorporate, we need to retrain them in order to know what are those, the assumption, the probability, the probable perception and attitude of the people that we consider to assume that it is towards that they don't want to take the vaccine being changed. So we want to review all those questionnaires and those questions that we can use for questionnaires and those that we can use for interview. So my own challenge is there. We are on it. Bit by bit, we will try to follow all those patterns in that. So at least that feedback is guiding us in order to have a very successful implementation of the action plan that we intend to achieve before 17th June. So this is the challenge that we are facing now on it.
Okay, thank you, Adamu. If I understood correctly, your challenge is related to getting to the bottom of or the root cause of what the perceptions, the beliefs around vaccine hesitancy among the students or some of the target groups that you're looking at.
That is the target group is the adults, among the adults, because they are the one that exhibit certain behaviors during the vaccination program. So therefore, we want to know, many of them, they don't want to take vaccine. Some of them, they connive that they have already taken the vaccine, but unfortunately, they have not taken it. So we want to find out what is the root cause of their own attitude and ideas, why they don't want to take the vaccine. So this is
Okay, Adamu, I have one follow-up question. I also, before sharing that, I also want to point your attention to two questions Meles Tefari shared with you or ask you. One is the causes of vaccine hesitancy really not known yet? Second, what have the reports and the research findings taught you about? So I'll let you think about that, Adamu, but my own follow-up question is the question number 5 you see on the screen here. I believe you are actively taking the responsive feedback module. What have you learned, or what steps of the responsive feedback have you tried, if any, to solve your own challenge? And was there anything that surprised you? Can you share a little bit about that?
Yeah, those, as regard to that, I just think some of the perception that the findings so far shows, but in the responsive feedback, it is somehow there are some of the things that the people shows that is not the root cause of not wanted to take in the stage of the assumption. That is the second stage after the stakeholder, and that of the available resources and the stakeholders. I begin to assume some of the questions, some of the reason why they don't want to take the vaccine. In that feedback, there are other things that has not been captured in the findings, the major findings that is established why people are not taking. But with that responsive feedback, I begin to see that if the steps of responsive feedback will be followed, definitely we may have some of the main findings that we may have at the end of the research that can be able to tell us that there are other findings that shows that the main hesitancy of not taking the vaccine, there are others that people tend to not even explain or describe them during the vaccination exercise. So the feedback is a very much effective tool in order to monitor and also to streamline your own action plan to follow it. When you are digressing, then that feedback, definitely when you are going to revise it back, it will guide in order to know the direction actually that you are going in order to achieve.
Thank you, Adamu. Before I turn to your peers to share what experiences or what comments and suggestions they can share from their own experience with responsive feedback to support you, I want to highlight a question from Tina, who shared in the chat. Thanks, Adamu, for sharing. Can you share more light on why you have to move away from the main health facility to other health facility? Adamu, can you please respond to this question before we open up the floor to invite peers to help you?
So the main reason why I just want to move it, you know, in Nigeria, we are facing a kind of an industrial action by both the teaching staff and some of the health workers. They are on strike. So therefore, this mandated me in order to move into some of the facilities in the local government in order to achieve what I plan to achieve inside the campus, the university. Because most of the staff that we can use, then they are not on work and they are on strike right now. So this is the reason why I'm moving into some of the facilities within the local government. That is the main challenge, that transparent that.
Okay.
So that is it.
Thank you, Adamu. I see many hands raised, your peers who want to share feedback to you. This time, I know Hassan Benya, you have your hand up pretty early. Hassan, just to confirm that you would like to share feedback with Adamu?
Is on which area?
Not feedback to Adamu, but I wanted to present my challenge and then agenda. So that was what I wanted to present. But unfortunately, I will be heading in another meeting, so it will not mandate me. But however, I've just posed a question in the chat box for colleagues to respond. Thank you. Over.
Thank you, Hassan. Right, as you rightly said, so we're now focusing on helping Adamu, but the question that you asked in the chat, if other peers have experiences to help you, the question from Hassan is, I wanted to know who can help with data completeness assessment for vaccine stock ledgers. So if you do have resources or tools or experiences to share with Hassan, please do so in the chat and type it out for him to see. So I want to go next to Daniel Kwesi Ekwam. Daniel,
okay.
your
All
hand
right.
is raised. Please introduce yourself and share what comments do you have for Adamu to help him with the challenge.
Thank you very, very much. I'm very grateful. I am Farm Daniel Kwesi Kwam from Ghana, specifically the northern part of the country, Upper West Regional Hospital, as the head of pharmaceutical services and a clinical pharmacist of the hospital. I have a little challenge with Adamu because where he's coming from, he seems he's now going to find the root causes of the perception of why people are showing hesitancy in taking of the vaccines, if I got him right. And if that is the case, I personally did that in my situational analysis. So I believe that if that is what he's going to find out, because now we are in the implementation stages where we need to implement actions to be able to resolve our challenge. So if he's really looking for the perception the root causes of the perception of why they are showing vaccine hesitancy. I believe you should have gone back and used the situational analysis steps to be able to find out the root causes of this. Then after that, he could then start implementing actionable steps that will help him to maybe to resolve that hesitancy. So that is where I have a little challenge with Adamu, that we are in the state of implementation. So it might not be too late, because IA 2030 is there for us to learn, and not just for one challenge. But once we learn, it becomes reproducible in other areas of our work, so that we can be able to implement it. And thanks be to God that we have responsive introduction to responsive feedback that have also come in the course of this implementation of our actions to resolve our challenge, that he could delve into deeper and get information that could also help him as he find out the root causes of that perception of vaccine hesitancy in the jurisdiction he's working at. So that is my little contribution and suggestion to him. Thank you very much.
Thank you, Farm Daniel. Next, I want to go to Professor Becky Tagabo. So Adamu, I'm sure that you're listening carefully. We'll invite each of the peers who have their hands raised to share their feedback with you, and then we'll go to Rachel, and then we'll invite you to share your reactions. Becky?
Thank you, Zah. Thank you, everyone. I want to, first of all, agree with the last speaker that we should be seeing much more action, even if you are still going to do some determination of root causes. But before I give my suggestion to Adamu, I want to ask him what was his situation analysis on, because his action plan is supposed to take root from the situation analysis. So like what he's doing is actually similar to what I'm doing. I also know that even if you took time to look at hesitancy in the situation analysis, you might still want to do a little survey and then carry out your action plan. So that is still possible. And in fact, that is what I did. I did determine vaccine hesitancy, but in this action plan, I still have a component of my plan to find the specific local causes that is local to my own context. So if that is what he wants to do, but that shouldn't just be the end, there should now be an action to follow. But I want to commend him on applying some responsive feedback when he discovered that the university is on strike. And so he's now looking for other facilities to make up, you know, so that's some flexibility. You know, he didn't just sit down and say, oh, they've gone on strike, I can't do anything anymore. No, he had to look for an alternative by looking for other facilities to make up so that he can still meet up with this plan. So that was a good one. But then when he's going to respond, I would like to know what he did in situation analysis that is now leading up to this survey that he wants to do. Thank you.
Thank you, Becky. Perhaps at this point, before inviting Meles to share his feedback, Adamu, would you like to respond to what Becky asked? What did you do in your situational analysis?
Yes, Prof. Thank you very much for the contribution and the comment, Prof. I'm very much grateful for your input. So I did the situational analysis within some of the areas around the university premises and those people that are going there for the vaccination. So I find out that most of the people, as you know, side talks here and there, some people are saying that no, this vaccine, they never took it. They have just gotten some card, they are just filling the card for them as they are vaccinated. So all this here and there, I've just gathered that's what prompted me in other to determine what is the root cause of this vaccine hesitancy among both the health workers and the staff within our own clinic in the university. So it shows that many people, they have different perception, attitude, and the knowledge. Some of them, they even don't have knowledge for not taking that, but they have their certain belief within the locality. You know, all environment, different environment, they have their own perception towards all those vaccines. So therefore, in the minor analysis, the situational analysis I have done, it shows that many people, they have their own different belief and perception towards taking that vaccine. So in that one, I will just go, since I have done that one within the university, but I will try to see that I will come back in order to do that before taking action. So thank you very much for the input.
Thank you, Adamu. I want to invite there are, I think, 3 more peers whose hands are up. I want to go to Meles first. Meles Tafari, what comments do you have for Adamu?
Yeah, thank you, Adamu, for your presentation, and scholars for comments. That's really important for his future replanning. I'm really happy to just listen this type of challenges. Maybe good to start from my questions. Vaccine hesitancy, the perception is actually different in different contexts, but it's not known still the cause of the perception in this local country. Is there no any data that really teaches you what really causes to not take the vaccine? What different articles, different reports, and even the people by itself, what they are saying that, what is the reason? So I think there may be a lot of data that may be helpful for you to strengthen your information. If there is no data for that, and you are going to just see or conduct some survey, it's very important to go back to your situational analysis that your situational analysis is the base for your action plan. You already develop your action plan to conduct research. Your action plan is initiated from your situational analysis. So what was your finding in situational analysis? It's really doesn't show the reason why people are hesitant to take vaccine. I think it's a very important question to go back and check again, so that really help you. And again, when we come to this responsive feedback, if you going to plan to conduct this survey to know the perception of communities in this local area, you have to identify the assumptions, the activities, and the learning questions that may be helpful to manage your future implementation and gaps that will be affect and to develop immediate solutions. I think it's very important to just follow the responsive feedback, and it's also good to see back your situational analysis. That is my comment. Yeah, thank you for.
Thank you, Meles. I see there are more hands raised of people who want to help you, Adamu. In the interest of time, I do want to go to Rachel first. I encourage Aliyu, Dr. Subarna Singha, Dr. Klimene Mukadi, and Dr. Haruna. Please, if you could type your comments to Adamu in the chat, that will be very appreciated. Rachel, you have heard Adamu's challenge. You've also heard peers' feedback. What comments do you have for him?
Hi, yes, thank you. And yeah, this is, I think, an interesting challenge because we work a lot with vaccine hesitancy and things like that in our work too. And I think that it's great because you're challenging the assumption that the data that you have is enough. And it sounds like, yes, we have a lot of vaccine hesitancy data and assumptions data, but you're understanding that that might not fully represent the local context and those local perceptions. And so I encourage you to make sure that you push that so that if you're going to do that, and if you're going to use like a questionnaire, like some sort of survey with quantitative responses, make sure that you are looking at that questionnaire and challenge that assumption that that questionnaire even gets at the root cause. Like this might be showing the questionnaire to others and making sure you're workshopping it or doing cognitive testing or anything with maybe more of a qualitative focus that you can talk to people and make sure that whatever you're sending out is actually going to capture these root causes and these perceptions that you're understanding. And I think to piggyback off of what other people have said, if this can kind of get at those causes, maybe those unique factors within your community, within your setting that are barriers that might not be represented in the literature, try to use this survey as an opportunity to probe on, okay, so what, how do we fix it? And another thing that I encourage you to think about is, all right, so they have a perception. So even if you identify that perception of they have an incorrect belief about vaccines or they're scared or, whatever that is that's local to your community context, where did that come from? And so this might think, okay, is there a community presence that is influencing their decisions? Like, are there community leaders that are very vocal against vaccines? Is the social media environment or the media environment something that's encouraging that? So it's almost a step back from their perceptions and beliefs, but what are those influences and maybe media contexts or community contexts that have kind of influenced those perceptions and beliefs? And so even stepping it back, because if you know where it came from, that might help you with that next step of so what. If you find that there is a belief, but it's being influenced from somewhere, then you kind of know, okay, if we're going to address it, we know what we're up against. We know the media environment or that information environment where they're getting this information. And so that can help as we move forward to address it or to kind of try to acknowledge that. So I think you're doing an excellent job to take those step backs and look at those assumptions, and then maybe even try to take a step or more back that can help inform those next evolve steps, as other people were saying. And if you're going to have this opportunity to gather this data, workshop it with people, even have a pause and reflect about that among your stakeholders, work through these questions and see where you can add and make sure you're getting that most bang for your buck as you're going to try to gather this data. So I think this is an interesting process and a really good opportunity to look through and make sure that you're able to capture these things and even push a little further.
Thank you, Rachel. Adamu, what would you like to say after hearing the peers' feedback? And I see Professor Becky Tagbo also shared the importance of local context in terms of vaccine hesitancy. So Adamu, what would you like to share back?
Yeah, definitely. It is very educative and enlightening. That's the importance of working in a group and coming together. In fact, I have well acquainted with all those recommendations, especially those that made by Richard. So I'll just go back in order to redo the action plan in the way that it will capture all the local context and that of what are the root cause of this kind of a hesitancy. Since there are so many researches on the vaccine hesitancy, but it depends on the context on which the locality is. My own locality will be different from other localities. But doing that one, we have to understand the root cause of the vaccine hesitancy in my area and others. Then I will follow all those recommendations that is made because of the time by the senior colleagues and that of the fellow scholars. Thank you very much for the input.
Thank you, Adam, and it's really nice to be able to see you with your camera on. I hope that has been a useful process, and for everyone who is staying in the room, Thank you for staying over time. I know we're 3 minutes over time already to help your colleagues with their implementation challenges to improve immunization where they work. And there are lots of chats, messages coming in the chat. So I encourage Adamu and all of us in the room to read and to comment on those. Before we wrap up the session, I do want to share some more practical information with you. So one thing is to highlight the requirements if you're thinking about getting certification from the responsive feedback module. Remember, there are 2 requirements. One is to complete the module itself before next Friday, June the 10th. The second is attend all of the 3 Friday live workshops. And if you have a legitimate reason for absence, complete the catch-up task. And one thing you may ask, how do I check if I have completed the module or not? There are 2 simple questions you could ask yourself. First is, have I marked all of the lessons in the module as completed in my personal learning space? So in each of the 14 lessons in the module, at the bottom, there is this sentence in red that it's asking you, do not forget to click on the mark as complete. So it's this button. If you click on it, it will change to completed, and that will mark that lesson as completed. And so if you have completed the module here, what you see here on my screen, it should be 14 out of 14 completed. If it's 13 or 1 to 13, that means you still have a lesson somewhere that you still need to click on that button, mark as complete. Second question you should ask yourself is, have I completed and submitted both worksheet number 1 and worksheet 2? So you could see that the many colleagues have already submitted their worksheet, the worksheet 1, worksheet 2, where you can see a screenshot of the current submissions, but go there, check if your name is in that folder. If not, that means you need to submit complete first and submit that, and ensure do not submit multiple versions multiple times. Only when you're done and when you think I am satisfied, I'm happy with what I have done with this worksheet, then click on the submit button to do that. Now, what are the next steps for the module? There are 2 next steps. First is the same thing as the first certification requirement. You have 1 more week to complete the module, including the 2 worksheets, if you are thinking about certification. Second, share your experience with responsive feedback and your feedback for the module. So for each lesson, for each of the 5 steps of responsive feedback you complete, once you mark it as a complete, there is an email from Rachel, in fact, who is inviting you to share. Is there anything that surprised you? Share your experience with that step of responsive feedback. And once you're done with the entire module, there is a post-module questionnaire that you're invited to respond, to complete, and to share your overall experience with, how did it go for you? Did you find responsive feedback useful? How exactly do you plan to use it in the future? So I hope that is clear in terms of the next steps for this module. And if we take a step back, this week is week 2 of the Impact Accelerator. On Monday, you have set a new action that you wanted to complete by Friday, which is today, in fact. And so today, I believe, Rita, you received the email from Rita, have you completed the action you set on Monday? Tell us how it went. Did you succeed? If not, what happened? Why? And what will you do differently next? So in terms of the form, I will share it here in the chat. If you have not shared a report back on what happened with your action this week, use the link I just shared in the chat and choose the option number C. I want to share my experience in order to be able to share more details about what exactly happened. So with that said, I want to pause here and perhaps turn to Rachel. I know next Friday workshop, Professor Vish will be joining us to help us problem solve and to support you to implement in the field. I want to turn to you, Rachel. Do you have any final comments to share with this group of scholars who are taking concrete actions to make immunization better? And over to you, Rachel.
Thank you. I just want to say, first of all, throughout both of these sessions, how impressed I've been with everybody's commitment to this process and through their really thoughtful replies and suggestions to others. And it's really evident to me that everyone is taking these modules and lessons to heart and really kind of understanding this core of what we're trying to get to. And I just want to encourage everybody to kind of keep pushing. And I think all of this, the suggestions on looking at those assumptions and pushing even deeper is just so helpful. And it's really encouraging to see everybody taking this to heart and doing this in their work. And just as a final, as we kind of talked about today, I know that you're not able to really move to that evolve step in your action plan, but just kind of trying to think ahead for it. And I think it's just really useful as you're probing these assumptions and working on responsive feedback, considering that component of, okay, what do I do? What next? And remembering that when you take that next step, you'll keep on monitoring yourself and making sure that whatever change you make in your program, you're going to keep monitoring and making sure that you're still on track. And I think just as a final point, within this module, I know we introduced pause and reflect kind of within that last step, but I do want to emphasize that pause and reflect can be such a valuable tool throughout. And, I think in the cases we heard today, just knowing that you can gather these stakeholders that you've identified, and this could be a range of stakeholders, from community people within the community up through the leaders of programs, to kind of problem solve throughout. And so that doesn't just have to occur at the end. If you have a survey that you're wanting to make sure gets to the root causes, you can gather this group and you can go through the survey together and really kind of talk through different feedback or different observations in the field to make sure that it's reflected through what you're going to do, and talk about, okay, well, how are we actually going to use what we find for the next steps? So these sessions where you gather these people together and talk through it, because I know you said you have your group of stakeholders, could be really useful. And even within the other example, having this time, if you're not able to be there, but you're going to have meetings that need to go deeper, can you actually use some of the time within that meeting to hold a mini pause and reflect, and have people reflect on their own activities or what's happening, or maybe what challenges they're facing to getting to where you're hoping to be. And so I think that that's a really useful tool to help people have buy-in and feel like they're really a part of the process too. And you can get a lot of feedback and information that you might not have otherwise gotten when you let people have a chance to talk and kind of be a part of the process as well. So I wish you all luck as you finish the modules in the worksheet, and thank you so much for being a part of this process with us.
Thank you so much, Rachel. And I do want to highlight that next Friday, we have our third responsive feedback workshop with Professor Vish Visvanath. And as Rachel has highlighted how useful pause and reflect can be, next Friday will be another unique opportunity for you to join Professor Vish to pause and reflect, for all of the scholars to come together to pause and reflect together. So with that said, I want to end here, and wishing everyone a good evening, good afternoon, and a good morning if that's where you are currently connecting from. So I just try a little something, ask everyone to unmute before I close up the room. Thank you everyone for joining. I'll see you next Friday.
Hello.
Thank you so much.
Thank you.
Thank you so
Bye.
much.
For a wonderful.
Thank you.
Bye.
Thank you so much. Bye.
Bye.
Thank you. Bye. Thank you. Thank you. Bye.
Bye.
Bye.